Hello and welcome to another edition of Wellbeing on Spectrum Television. Wellbeing is an interactive program designed to encourage a healthy living. My name is Mary Joseph and I am your host. Please do well to follow us on all our social media platforms at Spectrum TV, or you could visit our website at spectrumtv.ng. Just to keep your consciousness in check, today we will be talking about the importance of testing as one of the HIV prevention packages, with emphasis on the HIV self-testing kits. Globally, Nigeria has consistently been ranked amongst the countries with the highest HIV burden, with the country accounting for over 1.9 million people living with the virus. According to the recent National HIV and AIDS Indicator and Impact Survey report, Akwa State ranks number 1 with 5.6%, with Benue, Anambra, Rivers and Taraba states completing the top 5. Truth is, we might have more cases of people living with HIV, but how would we know without proper testing? Today on the show, we will be looking at the important role testing plays in HIV prevention in our society, and what are indeed some of the barriers hindering some persons to go get tested. Well, this and many more would be the focus of our discussion on today's edition of Wellbeing. We would have a health expert joining us much later in the show. Yes, to talk more about this issue and also to shed more light on the issues. But before then, let's quickly go on this short break. We'll be right back. You're welcome back to the show. It's still the program Wellbeing, your wellness talk show that is designed to keep you health conscious. Do remember to follow us on all our social media platforms at Spectrum TV, or you could visit our website at spectrumtv.ng to be a part of the family. Before we went on that short break, I introduced the topic of discussion on today's episode, and I said that we will be looking at the important role testing play in the HIV response. Testing has been seen as one of the key components in the drive to reducing the prevalence of HIV in the country. This is encapsulated in the just released National Prevention Program of the federal government, whose main goal is to reduce the incidence of HIV by scaling up implementations like the introduction of the HIV Self Testing kit with the context of the National HIV and AIDS Policy and Strategic Framework. But how effective has that been so far? And how often do people visit the healthcare center to get tested? We took to the streets to find out how seriously do people, especially those in Akwa State, are taking the issue of testing. And yes, we went to the social media, and these are their comments. So those were the views gotten from social media on how often persons visit the health facility to get tested and what were indeed some of the barriers hindering some from getting screened. Well, join me on our discussion segment where we had a health expert from the Infectious Disease Hospital Benue local government area of Akwa State, where we will be talking about this issue.
My name is Dr. Inam Udeme. I am the medical superintendent of the Infectious Disease Hospital Benue.
So how much of a burden is HIV and AIDS in our today's society? Are there statistics to back them up?
Okay, so thank you very much. In 2018, there's what we call the NICE report, National HIV AIDS Indicator Survey. It was conducted across Nigeria, and Akwa State had the highest prevalence of 4.8%, which a lot of people are still contesting, that prevalence. But for NICE report, that was the prevalence at that 2018. We've not conducted the latest report to know whether it has dropped or it has increased, but that's the latest report that we are working with. But then education, a lot of people are still afraid of coming out to do testing. A lot of people are still not following the ABCD that we talked about. For HIV to stop transmitting, there are ABCDE of prevention that we've said over and over. Let me repeat it here. The A stands for abstinence, that you must abstain from unprotected sexual intercourse. B is being faithful to a single partner. C is use of rotations condom. D is drugs, that if somebody is HIV positive, they must be on drugs so you can reduce the viral load and that person cannot also transmit. And E is the education. People don't have education up till now. And so for that prevalence rate to either come down or go up depends on these factors. That we must continue to sing this as a song to people to know that they must abstain, they must be faithful, they must use condom, and they must be on drugs if they are positive.
What can we do to manage these numbers?
Okay, so currently nowadays what we launch, U is equals to U, which means undetectable is equal to untransmissible. Now it means that you can have HIV, but the viral load is not detectable. As long as it's not detectable, you'll not be able to transmit. And so this puts us in the point where we are going now, that everybody, we advise that everybody must test. Now, immediately you test, you are put on drugs. And if you stay with your drugs, the viral load will not be detected. And at that point, you cannot transmit, because it's only a positive patient that can transmit. Negative people don't transmit. But we have seen positive patients who cannot transmit. And so this can only happen if you are on your drugs. So that the viral load is undetectable, but you are positive, but you cannot detect it. And at that point, you cannot transmit also.
If you say testing is very important, I would like to ask, why are people still hesitant to visit the healthcare facility to get tested? What are some of the limiting factors?
Okay, number one thing that we've noticed is self-stigmatization first. People stigmatize themselves, before we even talk about what we see outside where people live. People will stay on their own and start stigmatizing because they are afraid. Probably they've been engaging in all this risk behavior. So that will put them on that stigmatization so they cannot even come out to even test. Okay, next thing is when people come out, they think that there will be breach of confidentiality. So when you tell people come out to hospital to come and test yourself, they will come and see somebody that they know, one of their church members, one of their friends, and all that. So we advise people, when you come to hospital, don't leave those kind of fears. Nobody will expose, whether you are positive or negative, whatever. We will not discuss that. We have been trained to keep those kind of secrets. So we advise people, because if you don't come out to test, we will not know who has HIV, and we will not also put you on drugs. We can't just wake up and start putting people on drugs, okay?
Talking about stigmatization, do people still stigmatize? After all the messages that we've heard so far, it's been 40 years. I thought we've gone past all of this.
Last week, I had a friend of mine who called me. They brought a house help. This nanny now to him. He tested the girl. The girl was positive, and he sent the girl away. That's a form of stigma. So I tried to advise him, this girl is looking obviously healthy. We actually confirmed it was actually positive. So but that's a form of stigmatization. She was supposed to get that job now, but because she was positive, she was sent home. She cannot get that job. That's a form of stigma. So we want to advise HIV positive patients can integrate. They can become anything they want to become. They can go to school. They can work. What we want is that let them be on drugs. Mainly they are on drugs. All those other complications will not come in. And they can even reduce the viral load to the point that they will not transmit again. So people still stigmatize. I've seen it in several. People are also afraid that people will leak the information. So if you tell people come to hospital to test, they're afraid to come, or they feel if they're positive, somebody else will know. So we want to advise people. People don't need to be afraid. If you're in the hospital environment, nobody will disclose that information to anybody. I know a lot of people that I see that are positive that I can never tell anybody. I know of a wife that the husband is not aware. He's not aware till today.
So how do we now get different stakeholders like the government, religious leaders, traditional rulers to drive home the message of anti-stigmatization?
I don't know where to start with when you don't mention religious bodies. Because we still see people delivering at homes, and in those delivery points, they transmit HIV to the mothers, to the mothers, because they use unsterilized instruments. So how do you now? Because a lot of people still believe, we have people who come to hospital, register for antenatal, pass through the 8-9 months, and then, but when it is delivery time, they go back to those religious. So we want to advise religious bodies. Church is not a place for medical care. We go there to worship God and do our own prayer. But anybody that comes there for medical care, refer the person to the hospital so the person can be properly taken care of. Like there are some churches that I want to mention their name. We know them, that they have a place in those churches behind their vestry where they deliver women, and that's where they transmit, because they share those instruments. They deliver this one with this instrument, not properly sterilized. They use the same instrument to deliver the next person, and they transmit. Now, for government, what government should do is to make sure that they make HIV testing to be available at different points. Now, we can get it in schools, secondary schools. We can get it at people's workplaces. We get health workers that are well trained, and while people are at work, their director or their leaders at their workplace can announce that if you want to test for HIV, you can go to social location or social room number in this social ministry, and people can get, so we can spread, because a lot of people also want that convenience that they go to their workplace and they can, with a stone throw, they can just walk into a place and test. And when you tell them to leave that workplace and start paying transport to a health facility, that may be a barrier. They may not really. So the government can do that, make these things available close to where people are working. We can take the thing to the market. That's where we have a cluster of population, okay? And that's where we have the highest number of illiterates, because illiteracy is also a problem. When you start telling them, HIV is something of they will just mention one factor. It's not my portion, it's not my portion. So we can take this to the market, take it to the villages. Villages obey their chiefs and those town criers. So we tell them, the town criers will announce that doctors are coming to test at the particular location. They gather there and they are tested. This nice report, that's what we did. This nice report, we went to all the villages across Nigeria before we can get that, prevalence rate. So we can do that again. So the government can involve other individual churches so we can test people to know their status.
Coming back to the latest intervention created by the federal government to bridge the testing gap, that is the HIV Self Testing kits. Let's talk about what this is and how it works.
Okay, so it's very simple now. You see, before now, what we do is that when people come, we counsel them and we put them through the HIV testing where we prick, take blood. But you see, a lot of people are still afraid of needle pricks. Some people don't even want to see their blood. When they see their blood, they become jittery. So that's where that's how we came up with these new innovations, that you can actually test yourself at home. I don't need to prick. You just to get the strips, and it will teach you how to test yourself. Touch your buccal cavity, just saliva and your buccal cavity, and now put it in there's a fluid, and like a control. It will now show you how to read the result. I think that will make it to be more complicated on your own. But the issue that we have with that one is that if you test yourself at home and you are positive, will you be bold enough to come out? Because we can give you testing kits to go to the house, but we can't give you drugs to go and keep in the house, okay? Until we are satisfied that you are eligible, then we can now give you these drugs and we'll counsel you on how to take these drugs. Okay, so we are at that point now where we want to introduce that self-testing kit to everybody. But we also must know that it does not stop by that testing, okay? That by the time you test, there are other things that you must follow. Are people ready to follow those steps? That's where we are now.
Looking at Akwa Ibom State, what would you say has been the response to these services? Have there been any progress so far?
Yes, we are not really, we're not making so much progress. There was a time, I think last week, that I checked my store, and some of those self-testing kits have expired, because some people don't want to take. You offer them, they don't want to take. Why? So I asked one guy that I gave, and he didn't want to. Why are you not taking this self-testing? He said that if his wife or his family members see these things at home, they will think that he has HIV, that he prefers to come here and do the test. No. So people are having this kind of fear. So this still takes us back to education. Now, if you educate the population, educate everybody, people will know that for you to see somebody with this self-testing, it doesn't mean that he has HIV or he or she has HIV. So that's where we are going. Let's educate the people the more, like what you are doing now, so that people can accept this self-testing kit, keep it in their homes, and test themselves when they want to do the test.
Someone out there would like to ask, how accurate are the results gotten from the HIV self-testing kits?
Very accurate, but what we do is that's why I'm saying that procedures. By the time you test and you see the line strikes twice, that double line means that it is positive. You still have to report back for us to do the confirmation in the hospital. You cannot stop there, okay? So we have to confirm from the hospital from another method, because we have different methods that we use to confirm that somebody is positive. So we cannot use that one method to say that you are positive. You still have to show back. But what happened? Why that testing is very important? It is negative. It means that you are negative. That's where it is important. You know that you're negative, and you now adhere with the instructions to remain negative, like what we talked about, the A, B, C, or remaining negative. But when it is positive, you must show back for us to use another method to confirm.
Finally, how do we propagate the message of HIV self-testing to the general public?
Okay, so we have different methods on social media. We can use our phones, WhatsApp, like what you are doing now, put in your station. Other radio, TV stations should discuss it. It's very easy. Before you leave here, we'll find a way to demonstrate. So you can see it's very easy to do. Just a 20-minute stuff. Not 20 minutes to test, 20 minutes to read the results, okay? Within 3 minutes, the person has taken the sample, put in that fluid, and you leave. You can continue what you are doing at home, and in 20 minutes time you come and read. So we should propagate that so people will know that you can do it at the comfort of your homes, and know, because we want people to be sure. If you are negative, you cannot be negative by thinking. You have to be negative by testing to be sure that you are negative. You cannot just think that I'm negative if you have not tested. And so if you want to know, then you must have to test. So we need to share it. It's so easy to carry out. Even the tag illiterate, will just, if you just show him or her once, they'll be able to do that test by themselves and report back to us. That's where we have that small caveat. You have to report back to us if you are positive. Because we have seen people who are positive, did not report back, disappear to another place because of fear of stigma or whatever. So, but if you are positive, you must report back, because there are other things that must happen, the confirmation, the enrollment, and several other things that will happen.
So that was Dr. Udeme Inim, and we were talking about the importance of testing with regards to the HIV self-testing kit, which is one of the latest interventions created by the federal government to reduce the prevalence of HIV in the country. But beyond just hearing about HIV self-testing kits, let us take you through the practical demonstration on how to properly use these kits.
Good morning. My name is Nosime.
My name is Patient.
You're welcome to IDH. Please, I want to do a HIV test. This is actually a new test kit that's around. It's an oral test kit. So I'll be using this to do the HIV test. So first, let me open the test kit. This is how the test kit looks like. This is going to go to your oral cavity, just as is demonstrated on this. It's going to be going on the oral cavity. I'll just screw through, up and down, and then this is my developer. It's just like a buffer. That's what I'm going to use. So I'll stand my developer. And please, you open your mouth for me. Bend your head. I'll just go up and down, just the way, just your buccal cavity. This way. This way. Then turn it the other way around. Open. Don't worry, just open your mouth. Open your mouth. Is it paining you? No. Okay. Then I'll scan it in my developer. It will take for a while for it to read. The result is going to take about 20 minutes for it to get ready. Normally it's just one test kit for a client. So after making use of one test kit, that's the end for you. Then if it happens that your result comes out to be positive, that's showing 2 lines, mean you are reactive. But we cannot use this to proclaim you're HIV positive. No. You have to go through other test kits that they determine the Unigold and the Start Pack to confirm that you're actually HIV positive before we do that, before we proclaim you to be positive. But it's only one test kit for a client. Then at the end of 20 minutes, your results will be out. 2 lines shows that you are reactive to this particular test kit. A line shows you are negative. And then if you are negative, that means you should continue to stay safe. Make use of condom as your protective. Use one safe, you can make use of just one partner and then continue to play safe. Do you have any questions to ask? You don't have any questions to ask? Do you understand all I've said so far?
Yes.
No.
Well, this is where we draw the curtain on today's episode of Wellbeing. Thank you so much for being a part of the show. And do remember that you could also be a part of the family by following us on all our social media platforms at Spectrum Television, or you could visit our website at spectrumtv.ng. Join us next week for another edition of Wellbeing. My name is Mary Joseph. Until we meet again, remember that HIV is real. Get tested. Know your status to gain control of your life.